Cindy Bowl.
I'm Tanya Hyde.
Man organist.
Linkful. Aaron Sanders.
Brian Ebalski.
Steve Newton.
Julie Clore.
And that's who we are. So if you forget, you can ask. We won't be mad. Say, what was your name? So that's who we are. And first order of business after that is the minutes. So here, anybody have any discussion of the minutes or you want to approve them as written?
Motion to approve the minutes. I'll second.
We got a second. All in favor, aye.
Aye.
All opposed, nay. Okay, the minutes are approved. Then we have approval of the third quarter 2025 report.
Okay, so it's what we do 4 times a year. You approve the quarterly and then at the end, you just basically accept the annual as we put it all together. So that's the basis of this, just for as we start, some of the financial information is a little more in depth this time, just because I feel that there is a lot of information that our bookkeeper keeps, and we probably maybe even are going a little overboard on the information that she keeps for both the environmental and nursing division. But I kind of like displayed some of that. And as a explanation of our financials, so we have the different funds. The basic fund we have is the health fund, which is the county property taxes. Now, in addition to that, the nursing division and environmental go to quite a bit of effort to get additional grants and monies in for the health department in general. And it takes a lot of extra effort beyond just the minimum standards. And I always like to mention that, you know, we have the Health First Indiana, which is the last couple of years have been from Department of Health, and that's supplemental. We have the health maintenance, which is a legacy fund. We've been getting that for a couple decades, I believe. The local health trust as well. Public health preparedness is another, and there are other various smaller funds. So if we look at the health fund, and then we have a donation fund. I guess I want to make the point that a lot of these, some of the monies come in on behalf of the nursing division, and some come in on environmental or vital records and public health preparedness. So that's why there's all the different funds, and there's a lot of bookkeeping involved in kind of separating those out to ensure that the monies are historically distributed in the amounts that each of our divisions needs. So that's why there is additional information like the health fund financial report. If you move forward there, you can see beyond these figures, then the bookkeeper keeps a monthly ongoing record of receipts and disbursements, and then a total balance for each of the funds. So we roll on to Health First Indiana Fund, and you see that she has it divided up in environmental and nursing, so that we ensure each group has the funds they need to move forward with salaries and important things like that. You can see that the balance on this fund is the entire cash remaining. Something that took me a while to learn is the ledger and the budget. Probably a lot of you business people understand that. The ledger is all the monies you've accumulated and that may be in a fund, but you still haven't budgeted to spend those funds. So the cash remaining amounts are what we've gotten over time as a total, but we don't have that much budgeted annually. I like to use the analogy that the ledger is the well of money. And then the budget is the bucket. You go down in the well to pull the money out and spend it. It has to stay in the well until you use the budget bucket to spend it. That's about the easiest way I can think of explaining it. Health maintenance fund. So we have leftovers. We haven't really been using a significant amount of that during the Health First Indiana, but they have reduced the Health First Indiana spending significantly for our agencies, our divisions, going forward for next year. And so that makes things a little tighter for salaries and expenditures than it has been. It's been a great opportunity for us to enhance our programs, but at this point in time, we need to make sure that we're, able to pay the employees, which we have helping us, salaries, and it's pretty expensive to pay people with the benefits, the insurance, Social Security, and all those things. So the running up the BCHD cash ledger, that's kind of what I was explaining before. Keep moving forward there. This is not really, I don't know why this got attached at this point. This is not really part of the third quarter report. I'm going to remove that. Keep going there. Go. There, that one. And that's once again, just where the bookkeeper keeps an amount of monies that are assigned to each of the divisions or public health preparedness or vital records. These are the cash amounts once again in the ledger. And I want to reiterate that these aren't free monies to spend however we want. These come with grant requirements. There's strings attached, and there's a lot of requirements. I mean, I just got questioned on the words wearing apparel for $150 budget item, whether or not that meant a shirt or it meant a boot or it meant gloves. So you can imagine how complex it can be to spend the monies, let alone to keep everything straight regarding that. Okay, so moving into environmental health portion of the quarterly. So in the, let's see, in samples, I do want to correct that. The water sample number is not 5 total out of 2. We didn't create 3 extra ones there. That's just something we need to correct. So I want to make sure that that's part of our information. We did have 97 pool inspections. It shows we're out there multiple times, basically maybe 4 times a month, inspecting our pools. We have 40 plus different pools that we license. Education on the next page. A lot of that was us going to meetings and educating ourselves. We didn't hold specific trainings for the public, but that is something that we do during different times of the year. Let's see, housing. Condemned homes, we go back and check and make sure that when we condemn a home for whatever reason, it's not any longer habitable because of health reasons. We go back and make sure that somebody hasn't moved back in routinely because that kind of kills the whole theory of keeping them out of those situations. So we recheck those. As the Health First Indiana, the key performance indicators, these are the categories for the core service actions of Health First Indiana. And we do have a large list of the environmental core services, which they've kind of focused more on this year. And we are working on a huge data collection. I think Aaron's in charge of that for the Health First Indiana as far as the category core services. So we'll move to the on-site program. So we have 84 inspections here, and that doesn't mean we went to one system on 84. That doesn't mean we went to 84 different systems. Oftentimes, one inspection will involve the septic tank, it'll involve the distribution box, it'll involve the trenches, and then it's the final fill, and then it's some drainage around it, and then that they finally have it seeded and strawed. So one place, we might have to go out in the county 5 times to get it done according to permit requirements. So there's a lot of work there. And the same with repairs. So 37 of the repairs. And then we have 130 visits to properties over this quarter. That can mean anything from going out to seeing if a subdivision is going to work, to working with somebody to see if they've got a failing or malfunctioning system. And so we're out constantly, and we're out all around the county. And it keeps us kind of up to date on what's going on. We stumble onto buildings that shouldn't be there, that weren't there, 2 months ago, and are built over people's septic systems and stuff. So that's a lot of the regulatory part, as well as helping people. Vector, 1,200 mosquitoes trapped and sorted and sent to the state. We had the first West Nile positive in August, and that was in my backyard where we sampled that along the river lowlands. So that was exciting. Food. So numbers of inspections, we have routine 187 during this. So that's where we go out and we do a full inspection of every retail facility. As of now, we have 361 retail food licenses issued, with 39 also additional no fee retail foods, which might be a school or something along like a health facility, something we don't charge for, like the jail. 20 farmer market licenses, 84 mobile food trucks, which I think is a record for us. Before COVID, we didn't have maybe 10 a year. Now we're up to 84 of these actual contained mobile food trucks. 136 special events, which are anything to set up a tent and have a booth where you're serving food. So moving on to bites. Not a lot there. Dogs always win on bites. 5 cats, 1 raccoon. What did the state name that raccoon? I think they named it Rocky.
Yeah.
Rocky raccoon. Unfortunately, it was just Rocky's head that went to the state because it was removed humanely to have it analyzed for rabies. Okay, so we'll move on to the tattoo. That's a new segment for us. Our inspectors have been trained in the tattoo facilities. We have inspected and licensed each facility and artist we are aware of in county. 12 are at this time. You show 13 pre-openings. I don't believe one has met all the standards. So we have 12 of them plus the employees who are considered artists. And then now we're getting our routine inspection process. So that's been at least 2 years in the works to get that part of the Health First Indiana. And I always thought we should be kind of checking out what is going on in a tattoo parlor just from a public health perspective. Vital records. That's birth, death records, all of those pertinent vital records for life. So we got 210 deaths this quarter, 5 suicides, which I believe is up 2 from last time, 312 births, so that's outpacing deaths, 4 drug overdoses. And once again, the drug overdoses are each with a combination of many different drugs, up to 4 different drugs, which I've always found kind of interesting that, people are putting those many different drugs together and it's causing, I guess, it's sensible that it's causing some health issues, including death. And that's it for our portion.
All right, so for nursing, we always start with vaccines, so our immunization program. So we have 3 different pots. So we have vaccines for children, that's for kiddos that do not have insurance or they're 18 and younger on Medicaid. They come out of the vaccines for children supply. that is provided from the state. We do not charge them for their vaccines. We charge if they have Medicaid, an administration fee. If they don't have insurance, they do not get charged a fee. So we just list them all separately there, and if you keep scrolling down, you'll see that at the end or at the bottom, it says total patients versus injections. I always like to point that out, like we see 96 kiddos this quarter, but we gave 204 vaccines. So they might come in behind or on time and need multiple things. So I'd just like to point that out. The next pot of vaccines is our private. And this is kiddos and adults, but this one is gonna just show you adults. So we can bill most insurances. There's a couple that they're just kind of like one-offs, and I can't even think of one. I can't even think of the one that we usually get that comes through our drive-through, but we can bill most insurances, Anthem, SiHo. We are still billing in-house and we are still getting payments, so it's still a learning curve. We still get denials, but then we get them reprocessed and then they pay, so we're super excited about that. And then there's another section of vaccines, and it's called the 317, and that's essentially the state program for 18 and older. If you don't have, no, 19 and older. It's the whole Medicaid thing. If they're 18 and they have private insurance, then they're not considered a kid, but if, whatever. So 19 and older, if they don't have insurance, we can still provide them vaccines. And then the next category we've got to talk about, that's our pediatric private. And remember, this was the end of summer, beginning part of the school. So we had our back to school bash during this time. And so we've been trying to keep records of number of our offsite clinics on our paper here. This is essentially the categories that we have to document in the tracker for the state for Health First. And communicable diseases. So I don't remember the number of reportable diseases that are to be reported to the health department, but I can tell you if you're interested. But this is the majority of the ones that we investigate. So we help with the tick-borne and the poop-related ones. For environmental, we gather all their clinical information, and they do the investigation, so we don't list them on our report. But you can still see syphilis is going strong. We did have a little decrease in chlamydia for this quarter, but that's that one. If you have any questions, don't hesitate to ask. And so we do also provide HIV, Hep C, syphilis, chlamydia, and gonorrhea testing at the health department. And we can provide treatment for them as well, if the state provides that for us. Condom bags, we do hand out condoms. They just have to come in and ask for a brown bag. We don't ask any questions unless they would appear that they are very young, and then we would have a conversation. But anybody can come in and ask for that. And then we do have a Sharps disposal program. So you do have to be a Bartholomew County resident and have a prescription need. So if you're like a diabetic and you're on insulin, or any injectable, you just bring in you can bring in the paper from the pharmacy that shows that you got it there, and then we give them a Sharps container, they fill it up, they bring it back, and we dispose of it and give them a new one, just so we can keep Sharps off the street. If anyone has any that they need to bring in their coffee containers or laundry containers or whatever, we'll take them and dispose of them and get them in our program. Maternal and child health, we do still have some pregnancy tests and vitamins. But once those vitamins are gone, we will not be replenishing those. Let's see, I just went to the eye doctor today, so I'm getting bifocals. But for today, I'm still struggling. So we try to do a lot of referrals. If they don't have a doctor for themselves or their child, we have a partnership with Well Connect that we can give them a call and they can get them in places with Nurse Family Partnership. That's that. Expanding. Chronic disease and prevention, we do A1C testing. Our numbers are still down for that, so if you know anybody, send them our way. They do get their first one for the year at no charge, and then any after that is $12. We can check blood pressures, they come in, their height and weight, we can give them education. I do have a home visit nurse that goes and sets up medication setups for individuals in the community. And she currently, well, in September, she had 16 or 18, I think that says. So she, I think, has about 20 now. Okay, next. So we have 2 school liaisons that will work with the, Abby works with the private and parochial schools and Tracy works with BCSE. And so they're available to help with hearing, vision. They check vaccine records, however the school nurse needs them. They check on them often and they are pretty self-sufficient, but they do call us if they need us. So fatality review, that's one of the core services with HFI. We do provide safe sleep education, as you know, sleep sacks, gun locks, our medication disposal bags and our medication locking bags. So we just track that because we have to use that for the tracker for the state. And those are all no charge. Trauma and injury prevention, that's going to be, talking to kiddos and parents about wearing their seatbelts. We have our seat technicians that were actually trained by Tanya. So they, which I'll tell you about a little more, we've got some exciting news about. So we check their car seats and give them out on bike helmets. Smoke alarm referrals, that's with the Columbus Fire Department. So as the girls are talking to patients, if they find out they do not have a working smoke alarm in their home, then let me know their name, address, phone number. I send a note to Mike Wilson and then he contacts them and gets those installed in their home. So we keep him busy. TB, so we do the blood test, TB blood test. And Mary takes care of all the case management. I don't want to say it out loud, but we'll knock on wood that I think we're good as far as active cases not being around at the moment, so that's good. That's the home for that one. Tobacco prevention and cessation, so that's no longer a core service with Health First, but we are still providing those services, and we're partnering with Healthy Communities, Kylie, so we refer people to the Quit Now line, and we do still have NRT kits that we will use until they either are all distributed or expire. And then we'll work with Healthy Communities more with that. All patients are screened for food insecurity when they come into the office, so we just ask the 2 questions, if they're worried about not having enough food or not having the money for it. I can't remember exactly what, it's along those lines. So if anyone answers yes, then we have information that we will provide to them. We have referrals for SNAP that we submit, so people can reach out to them and get them enrolled if they would qualify for that. So that's essentially just our little referral page. Is that it, I think? No, lead. So we do lead screenings, mainly on Thursdays. So you should have your child tested for lead at 12 months and 24 months. If they have not, then before they turn 6. So we screen any kiddo, 6 and under. The girls can look in the hospital record to see if they've been tested at the pediatric office. It's supposed to be documented in the CHIRP state registry as well. And then if they have not, then we provide that service for them if they consent. And then they follow up if anyone's elevated, and there's a little chart that we follow. That's Tara's note there that I mentioned before. I guess we have it documented twice. So our children's dental program has went away. But it's just still in this report because we had it still earlier in the year, but I do have a dental hygienist, Colleen, who can provide education and goes to the schools, and her maiden name was Fairy, so she's the tooth fairy, and she dresses up and all the fun stuff. I know, that's it now. Okay. Any questions? It's a lot of information.
Okay, I don't hear any questions, so I would entertain a motion to approve the quarterly report with correction.
I move to accept the quarterly report.
I have a second.
Second.
All in favor, aye.
Aye.
All opposed, nay. Okay, it carries. Next on the agenda is the nursing division.
Yeah, so just a couple things. We launched our newborn safety class on November the 13th. So we had 2 participants. It was a husband and wife, and they were absolutely adorable. Came with lots of questions. But we covered safe sleep, water safety, and car seat safety. And we had a door prize of a infant carrier car seat, which they won. They were just tickled, and it was a good first class. The girls went out, they had a car seat already installed, and the dad was worried that it wasn't right, which he had it almost right. It was just a little loose, but the girls he wanted them to check them. So they went out and they did the little car seat inspection, and it was supposed to be a 30-minute spiel, but he just asked all the questions that every first little daddy does. And I think they might have left within the hour. So we have our next class is scheduled for December the 11th. If you know anyone they have the options of 9 o'clock or 1 o'clock. It's only 30 minutes. They could still be pregnant and come, or through age 1 if their baby's up to age 1. So have them call the health department. We would love to have them. And so I think we're gonna do a couple more in-house just to make sure everybody's got the jitters out of the way. And then, the Excel Center and, McDowell are interested in us coming and doing a class. So we said after the first of the year, just so we work out the kinks, because you know, the first couple times you're like, oh, I forgot this or whatever. But the girls did an absolute phenomenal job. So there's that. Then I got an email from someone with the Indiana Criminal Justice Institute. She said, I see that you do car seat inspections. I was like, yeah. She's like, well, we would like to provide this grant to you. So it's with the Automotive Safety Program. Did you know about this? You probably told her about it. The criteria would be to have 2 certified child passenger safety technicians. We've got 4. To be available 10 hours a month for car seat checks. Well, we're open 8 to 4, Monday through Friday. We submit the car seat inspection reports online, which the girls already do. And then attend a conference or complete a refresher class each year. So we definitely qualify for that. And then I did say yes, and the commissioners approved it. So I hope that you also give us your blessing. That they will provide us 16 car seats a month. Now, not necessarily 16 are coming each month, but we start with 16 and say we gave out 5, then the next month they'll replenish the 5 so that we will keep 16 each month. So I said, why not? So is everybody okay with that? To be eligible for a car seat, they must show that they have a need. Be on state assistance like Medicaid, WIC. They just have to attest to it. They don't have to show us proof. Be a resident of Indiana, which we're already checking. Identification for that. And be the primary caregiver. So yeah.
Since it's funding, do you want us to approve it? Would you feel better if we approved it?
Sure, if you want to give us the blessing, that would be great.
Okay, so do I hear a motion to approve the car seat grant?
So moved.
Second,
Second.
okay, all in favor, aye,
Aye.
opposed, nay? All right. It's all official now.
Thank you. And then this is what I told the commissioners on Monday when I had their meeting. So far this year, we have inspected 49 car seats and we've distributed 30.
Oh, wow.
So that's like, they came, they didn't realize that, you know, their little 5-year-old still needed to be in a booster, or younger. Or they had outgrown it and was still, like we just had a little 2-year-old that was still in a little infant car seat the other day, so. I mean, granted, she was still little, but, didn't quite fit for her. So there's that, and then the Health First Indiana there was one county that opted out for 2026, so we got an additional $5,883.74, which we split that, so each of the divisions will get $2,941.87. And I just threw my portion into the core service supplies and had to send it back to the state, but I don't know which county has opted out. They haven't shared that yet, but I'm sure once they update the website, you'll see somebody not agree. And that'll be the deciding factor. But That's all I have.
And then I believe in general, they go back to legacy funding, don't they? They can.
They would go back. So our legacy funding was the health maintenance and the trust and we received like 82,000. Which is still, I mean, even though our health first got cut, we still get 420 some thousand. I mean, it's still more than 80. So
Mhm.
They have their own reasons and I don't know what they are, but they would revert back to that way smaller amount.
Health First Indiana is a challenge as far as, you know, you have to do a lot of data management, which is okay. We've got employees to do, I think, a smaller county, it might be a little more difficult to do all of the book work required, but we don't seem to have any problem doing it. Are we all, are you?
I'm done.
Okay, all right. So I start out with Health First Indiana, because that's a big topic for us. I just really wanted to go over some of the accomplishments in 2025. We've been able to help with community health in the core services. Let me go green here. Okay. So we bought an advanced electric motor fogger for mosquito treatment from Clark Mosquito Control, along with, at this point in time, 20 gallons of synthetic pyrethrin, which is a very low volume. I believe it's about 2 ounces per acre as we're using the motor fogger. So that's a huge update on our program. And it moves us away from the gasoline engines to a little more advanced electric motor, which requires less maintenance, quite honestly. We purchased 5 external defibrillators, AEDs. Those were 4 for the county parks. So those have been spread out among manned recreational sites at county parks. You can't just put one on the wall or disappear. It's got to be in a shelter house, or it's got to be, you know, like out at the new pickleball courts. I know they have one there. And one of those went to the courthouse. I guess they had some pretty old ones in the courthouse, and they just installed this week the one on the 3rd floor from us, and they were basically applauding the health department for the help there. We paid for the removal, proper disposal of approximately 329 tires from several properties, including some county tires that had piled up that were allowing mosquitoes to breed in standing water. That wasn't terribly expensive, I didn't think, and it was a good way to advance our vector control, mosquito control. Let's see, we had 20 heavy duty beware of tick signs made for trailheads at parks and rec sites, which have heavy foliage. And we are currently having 20 more made. And I know that Dr. Newton is interested in maybe having 1 or 2 of those to spread out. We bought 3 laser levels to replace our wastewater system installation equipment, which requires extreme accuracy. We bought a replacement pool chemistry kit and reagents. We assisted the commissioners with payment of $43,000 to continue the development of our Inspect2Go data management software. That Health First Indiana also assists with the salary for our assistant director, who's sitting next to me today, which has helped greatly with training new employees, developing policy and procedure, extensive cataloging of our equipment and resources, and back up to me for all the work review and human resource issues, which is great, very good. And I think that's very helpful. The salary for the public health preparedness coordinator and their 2 summer technicians, those were moved from the health fund to Health First Indiana when it started to pay with state funds instead of the local property taxes. Those will most likely need to move back to the original payment from health fund, as it's been for approximately 20 years. But I hope that that's not a battle to fight as long as the powers that be realize that those positions originally were paid for by a different, not grant.
Do you anticipate the county council and commissioners not liking that?
Well, they have stated that if grants cease, then the positions paid for by them cease. I just kind of want to make it known far and wide that we were saving the county money by putting it on Health First Indiana with the intent to move it back if those so. For my experience in my position, I'm not so sure that that will be a smooth transition.
We can go to the meetings with you if you want, if you just want bodies.
It's always appreciated. And so bringing up data management. So Ashley Rolfton, one of our inspectors, has been helping me work, and I know there's no cameras here, but I'm showing a timeline regarding our long-term goals and work towards securing a comprehensive data management plan for our office. So in 2015, our office paid $19,000 to Win Records to update the service and include many of our programs. And that was with the previous information technology department, and really no forward movement was made with that. 5,000 to DocuWare for expanded user licenses. We did find that those user licenses were used by other county offices that we had paid for. We have worked with the prior info tech staff in that time, and in 2018, we requested assistance to determine what DocuWare, Win Records, Access contain, and how we might develop a data management software suite to digitize, group, and protect our data. So we have been working on and off. COVID came, there were delays. 2021, we did choose, with our information technology department, they did help us choose Inspect to Go. And we've worked for several years now in a project which seems to have grown beyond the original goal of having a searchable database of our paper files. One of the problems we've run into is the company has been working towards an application-based field software with remote data input for the inspectors. And I think that the county has been more focused on internal server that didn't really have, at this point in time, a lot of remote input opportunities. So we've requested with Mr. Mays and his office that we have a review of the program. Maybe we can get back to getting our 400,000 pages of septic files scanned and get them in a searchable database in a digital form. That was my intent in 2017, 18, in that period of time. So you can see that it's, we've lost staff have come, they've understood the Inspect to Go, and then they get jobs elsewhere. And then the next person comes, and then the information technology department will be, you know, there'll be a big project that comes about maybe at the courthouse or with the sheriff's department. So I think keep it simple, stupid. The KISS method is probably the best, because we have really gotten an advanced, all-encompassing software product, and I think we can get it done if we just scan our records in and make them searchable. That was my goal to begin with, and that's what we continue to do. As far as, Ashley, you can see she's been very busy. She's like got multi-dimensional 4D chess kind of a time frame. So we need to narrow that down and make it a linear time frame. So at least we can have an accurate history of our attempts and movement forward with digitizing our records. As far as employee achievements, I wanted to to kind of give kudos to our inspector, Ashley Ralston. She's been with us for 2 years now. And she did complete and got the Masters of Public Health degree from Indiana University. And that is a big step forward. And not to make Dr. Nubalski nervous, but in the IC code currently, it states a health officer must be a physician or have a master's in public health with 5-year public health education. So,
We have a succession plan here.
yeah. So in essence, my inspector kind of is going to outrank us all here. But that's good. And I'm investigating a stipend or raise of some sort for this employee for this achievement as an enticement to stay with us. We don't lose her. She's a good employee. Our new Inspector Kelsey Bryant started in July. And to give you an idea of the training that we put them through, it's really more of an apprenticeship than it is a job as far as working on the environmental side. She's attended training and received certification since July in the Serve Safe Retail Food Manager training and certification. She's a certified pool operator. She has gone to Purdue University to do the core training and get her certificate in pesticide use and application. She's attended the educational conference for Indiana Environmental Health Association. She right now is at the 2-day annual Environmental Health Specialist Rules and Procedures and Orientation training. She's going to be field training with a state inspector for consistency and retail food inspections. And then Aaron and the rest of us have been going out with her constantly. She'll have approximately a 2-year training for the on-site wastewater because it's probably our most complicated thing that we do, as far as every site's different, every soil's different, and every situation is different. And we can't be giving recommendations willy-nilly. We have to know what we're doing because it's expensive and it's wastewater. We want it in the ground. We don't want it running off into the streams, ditches, and groundwater of the state of Indiana. Okay. Any questions on any of that? Just jump in. Like I'm not really caffeinated. I'm just trying to get us to the meeting this evening.
Game starts at 7, you said, right?
I can deal with it, but some people would like to watch it.
Are there any other updates from anyone? Can't imagine. So do we have any old business? I can't think of anything that we've got.
I think we've hit it all, don't we? Yeah.
So can we move on to new business?
Well,
And
thank you for your participation, Ashley, on the board.
Thank you.
Thank you for your service.
yes,
Thank you for having me. I'm like continually impressed by all that you guys do with this. Keep doing
Well, thank you.
it. Thanks.
It's nice to have a resource with utilities. Yeah.
We'll keep doing that.
and I'm trying to read what's.
Do you,
Dr. Hale joins
Oh.
January.
Keisha, did Andrea give you any copies of the agenda? Okay.
Yeah, my printer's broken at home, so that's why I'm reading off. here.
right there, I'm sorry.
Oh,
Let me grab her one. Or can you throw her one? Just to
I got.
get us through here.
I could not print. Thank you.
Thank you.
Oh, that's much easier to read.
Reduce the squint factor a bit there.
Yes.
I'm good. I've got one. Thank you very much. Appreciate it.
So with Ashley gone, we will have Dr. Hale joining us in January. You remember?
And I believe we've got everybody's ACH information to be able to have the stipend that's given for each board member to them. I was checking with Mildred, our bookkeeper, today. So we're all set. People that attend, we do have a provision where there's at least a little bit of cash coming their way.
I can tell you that. Everybody's coming.
Get some gas and bread anymore.
I think I was the last holdout on the ACH, so they don't have to worry about it
Yeah,
now.
yeah, that's a lot of,
Not on purpose, I just,
oh, I was gonna say, a lot
not
of
through the
personal,
process.
a lot of personal information. My dad just had to do a credit card where you have to do a selfie of your face this way. And then you have to do your driver's license both sides before they'll
Oh.
activate your card. That's too much data, I think. but That's a whole nother subject.
We don't have a date for a January meeting, do we? You set a
No.
date?
We need to set those, and then we were gonna talk about meeting times, if,
Yes, we were.
anybody would be interested in meeting earlier in the day. Cause we now get out at 4. Yeah.
I'm fine with it, but those that work,
Yep.
might be a hardship.
Well, one of the problems is they've moved now we no longer have a lunch. We kind of work through an abbreviated lunch and we get off at 4. So it's not our convenience, it's yours as the board, but if there's no reason to,
Is that a conflict for anybody in the room being here for?
If we stick with Wednesdays, it's not, because I don't work on Wednesdays.
I can make it on Wednesdays too at 4.
Me too.
I could not.
you
I mean,
can,
I could always amend my schedule, but I'm usually seeing patients until 5.
5, okay.
But just a few meetings a year, it's not gonna be a problem.
Mhm. Well, that is up to you, sir.
It's okay.
Well, you
We're talking 4, or are we talking like 4:30?
We're talking whatever the board wants at this point in time. We were just kind of bringing it up. If it didn't make any significant difference, I personally don't care. It's,
If people are still in here till 4, we might have trouble parking, so it might be better. Except for, I hate to make you guys stay a lot later, but it might be easier to meet a little after, like a.
Do we say 5 o'clock and then Dr. Nabrowski only has to maybe bump his schedule by a half hour instead of an hour or more?
I could do 4:30.
Okay.
That's fine.
So I
Sounds
see
good.
4:30, I see a lot of, yes. Can you do 4:30?
Yeah, I could do.
Okay. So let's look at 4:30 then.
Okay.
And
When's our first meeting generally?
like second week, I think, second week of January.
First Wednesday is the 7th and the second Wednesday is the 14th in January.
I do know that Dr. Hale is not available on the 3rd Wednesdays of the month.
So the second,
well, I don't care what, is the first Wednesday when we usually meet? Oh,
It's buried.
it's all over, isn't
It's
it?
all
over.
And we haven't got,
we just kind of change everything totally
Yeah,
every
you-
year, so.
Well,
Whatever
even
works for
throughout the
everybody.
year, we don't necessarily pick it's not like we're always the second
yeah, it's
of
not.
the month or anything.
No, there's not a lot of consistency.
Well, is there an advantage for us to meet earlier, like the 7th, will you guys want for it, for improving the year-end
don't-
stuff and everything? Is it
Yeah,
better
I
to do
think
it earlier?
later in the month would be better
Later
because
better?
usually the vital records is stuck with getting the information from the state.
Do we want to go as late as like the 28th then, which is like the end
I
of
don't think there'd be
January?
any argument going that 4th week. If that works for anybody.
Since you said somebody wasn't available on the
Yeah.
21st.
It's fine.
I'll be on Zoom because that's when I'm in Florida, but that's okay. I mean, I
Me
can do
too.
Zoom,
As long as you show us
the
the
28th.
background and how nice it is.
I'll take it out on the patio or something so you
Yeah,
can,
that'd
you can
be-
see the nice
That'd be
weather.
wonderful. Thank you.
So the 28th at 4:30?
Yeah.
All right, next meeting is January 28th at 4:30.
And then at that point in time, we can kind of go through the year. If you want to, or
Do we want to just do this
We-
now?
I think we do it now.
I think that would probably be better.
Mildred has to send in the certification of the board members and the dates
That way I
to
can
the state.
let my
April,
office manager know which
Sure.
dates I'm gonna need to be out.
Then isn't our next one normally in April?
I think so. April 8th, anyone?
Yeah, sure. April 8th.
April 8th, is that what I heard?
Yeah. And I think that we do July because we have to go
That's
to
a-
council in August.
I think it was. Wasn't it near the, after the 4th?
Mhm. July 8th.
July 8th.
So July?
8th July.
July.
And then
Don't we have one
October?
Did we two more, October and December?
September?
We
Was it
only have to
September?
have 4, right?
We only have to have 4, but I feel like we've done 5, so let's.
Well, I think that we had a lot of data. We were getting 2.5 hour, 3 hour meetings. Especially with that first Indiana stuff. That's up to you guys.
Last year we met in April, July, August, September. No, that's 2024. Sorry.
I think we met in like July and then September and then December,
Mhm.
but do we need,
When do you do your budget?
The July one's gonna be the budget.
do we need the July
So
one?
we need the July.
We just did third quarter in December. Could you push that one to like October and November and then not have another one at the end of the year? Or do we need one in December?
We can do whatever you would like to do. I mean, I'm game with whatever.
We can always add a meeting if we need to.
Do we
It
want to
works
make
for
it then,
everybody.
maybe when did you say, October or November?
Right. If we did this one and we reviewed third quarter, it would have to be in October or November, so we could review third
Mhm.
quarter.
Usually we're 30 days after the end of the quarter, about as fast as we can get the paper.
Yeah.
Well, we could do November and then.
But then I feel like we'd probably be doing second quarter and third quarter, because would you have second quarters done in July? Or do we need to push, because that's only the 8th of July?
Probably, Beth probably wouldn't get the numbers.
So
Mhm.
do we need to push the July meeting back towards the end of the month so we could do second quarter and budget all at the same time?
Yeah, as long as we, submittal budgets is
Yeah,
June 1st, but we like to go over it with you guys before we go.
I don't know.
Council. and-
So. July,
You said we have to move April's back if we're gonna do them. Yeah, April,
April's early too, April's 8th,
yeah,
the 8th.
the April meeting may be too early to do first quarter report.
Unless we want a bunch, second, third, it just makes a longer meeting. Or first and second or whatever.
You're the people who have to get the work together, so.
Why don't we push April's back to the 22nd? Cause that would give us first quarter. Okay. Keep July since that's budget. You guys need to go to the,
So April 22nd.
April
because
22.
otherwise I'm not sure what.
That would help.
So,
And July, you want to push July's back too then?
Well, but they need the budget. They need us to approve
Oh,
the budget
but-
before they
so
go to the council.
July needs to be early, okay.
So then do we stick with like October and approve second quarter and third quarter in October? If you haven't managed to get it done with budgeting in the beginning of July with that quarter, I mean, just
I
finished.
think we could do 2 quarters.
Yeah.
So October,
I mean,
something.
it's essentially just getting the bill.
But you probably need to be towards the end of October, right?
So 28.
28th. Then do we want to
there's
meet in
4.
December again?
That's
Or
4.
we want to wait till, that's 4 already, so we could do January and do all of the fourth quarter, that he did this today, and we could do the other stuff too in January 27th.
Mhm.
So we have our 4 meetings, so January 28th, April 22nd, July 8th, and October 28th. Does that sound right?
Yep.
I wrote
Yes.
down. Okay. All right, and in January, we will do new officers too. So.
We change it up a
we
little
can
bit.
Change it up a little bit,
You have to, a little.
a little bit.
We will.
Well, yeah, Ashley's
Ashley's
about
about ready.
No.
Steve.
I was gonna make you the president.
Always
It's
have
not
to-
hard.
We just.
Have to have somebody that attends, and so that we're good there.
Okay,
So we can't appoint Dr. Tannenbaum?
we need to hear about the restaurants before we go.
Well, I have it here, if anybody wants to, I've got a few things going on. They write it out for me, and sometimes I don't know where the addresses are because it's some little, forgive me, hole in the wall that I've never heard of, that's like 20 feet wide and 30 feet long. So let's see, for new construction, looks like the Olive Garden was projected to open this month. I think they're gonna be a little rough getting it done this month. We haven't begun our inspection process, which usually takes several visits. And then all of the different code enforcement and fire gets in there. Utilities make sure that they have the grease traps and stuff. But anyway, they're making good progress. Nothing on the KFC Merchant Mile yet. I think that we've pretty much said that that's been going on so long, we've been mentioning it so many times that, if you're interested, get back with us. That happens a lot. A lot of these places do exploratory plans, and then they just don't have the money to invest in it. Dollar General Garden City, I see going up. What did they do with wastewater? Do you know?
They're connecting to our force main.
Okay. Yeah, we were like,
It's a little sketchy.
oh my goodness. Okay. Champion Zone Golf, where is that at?
Next to the Harley Davidson dealer.
Okay, up near the outlet, okay. Forge on Fourth is getting a license. The annex is under planning, and that's the one down on State Road 58 by the water tower and the fire station. It's quite an elaborate plan with several different buildings, and so they're looking to have kind of a high-end facility there with incorporating that church that's in that location.
And what is that facility gonna be again?
Like a dinner club kind of, and with outside dining, inside dining. And unfortunately, the wastewater disposal is a question that we're working with because it's very important to the plan when you have potentially 80 people seating. And those kind of things you want, and employees and the use of water, and then you're out in the country on, you know, clay type soils. We always get the the bad end of the stick on as far as developments, because we want to make sure everything's done according to oil. Let's see. Stunna's meal prep, which one is that one? That's
On Central Avenue.
okay, in the complex on Central Avenue. Okay. That's a remodel. So recently opened, we got Riviera Maya and the old Johnny Carino's. Winnie Moki Donuts, that's on
they're off of the Mar in the theaters.
okay. Unaguate, this is quiz for you.
Yeah, it's a little Mexican market in the Holiday Center.
Okay. Wings 144,
It's in Stunna's Meal Prep. It's a piggyback license.
okay. Subway Walmart East has opened. So they reopened that one that was behind the walls there for a number of years. The Bee,
It's in the Shirley Paul's Catering. It's a
Okay.
piggyback catering operation.
so recently closed Big JT's Barbecue, right? Chopsticks, Mi Casita, and today Ruby Tuesday closed
Oh, they did?
up at the Web Mall.
Surprising.
And we've been a number of times to the gas station convenience store at 11th and Washington. And that they're so close. But they're not there yet.
I've been so close for a long time.
They've got a,
What's the holdup?
Do they just not want to open?
just various agencies involved have issues
Fire and code enforcement.
with things that aren't quite right yet. And, some of the equipment isn't there and we can't approve, you know, things based upon future speculative things that might occur to meet our code. So,
There is a vape shop in there. Is that open now? The vape shop?
No, yeah, not yet.
I think it's only been open when people throw the LP tank through the front window, so. That's occurred 3 times, I believe, so
No.
that's unfortunate there in such a bold and public location that there's that criminal activity. So that's it. That's our update.
You want anything else?